Great. Thank you all. Hi, I am Amanda Slater. I am one of the Assistant Deputy Directors for the Department of Health and Human Services. Welcome today for our quarterly contracted providers call. Always a great opportunity to provide some information with you all and get any feedback or questions from you. For those of you that are new to this call, we have several division representatives within the department that will provide some updates and then be available for questions and answers at the end. Before we get started, we do want to make sure that we've asked for some feedback so that we can ensure that these calls are always serving you better and are valuable for your time. So we do have 3 questions that we will be putting up as a poll on the screen. The first question that will be coming up is, how many of these webinars do you make it to each year? So if you want to go ahead and answer that. The third question is, what is most valuable in these webinars? And then the third question is a short answer of, is there anything else you'd like to get out of these webinars? So we'll go ahead and leave that up for just a couple minutes so that you have time to complete that poll. While you're doing that, I'll just do a few quick virtual housekeeping reminders. There are closed captions available for those who would like those. If you click on the live transcript in the menus bar at the bottom of your Zoom window, it will enable those closed captions for you. This meeting will be recorded for those of you that are not able to attend, and it will be uploaded to our YouTube channel so that you can view it at any time or share it with those that were unable to attend it. At any time during the chat, you can enter your questions into the question and answer, or during the call, sorry. Anytime during the call, you can add your questions to the Q&A feature at the bottom, and we'll do our best to answer those during the call. They can be related to information that we are presenting, or if there's other questions you have available for the panelist. In addition to that, questions can be submitted anytime prior to this meeting by submitting them to our CQI email, and we'll drop that in the chat. All right, we'll give it just a minute more and we can close out the poll. Couple quick reminders one quick reminder before we move to some of the others. Those of you that are contracted providers with Department of Health and Human Services, you should have received reminders about the end of our fiscal year billing that ended on June 30th. Today is the last day to submit any outstanding billing forms for any services you provided between July 1 of 2023 and June 30th of 2024. So please make sure you get those submitted by the end of the day today. We want to make sure we're able to get those bills paid for you all. If you have any concerns with any of your payments or any questions, please work directly with your billing contract for your applicable OU. And then a couple just quick changes. Just wanted to announce some DHHS leadership changes. Most of you are aware we've had a change in the Division of Licensing and Background Check Director. We now have Shannon Toman Black serving as that director. That division still includes our Office of Licensing and our Office of Background Processing. So definitely reach out to Shannon if you have any questions. We will also drop her information in the chat, so if you need to reach out to her. And then with Shannon, as most of you know, she was our division director for the Division of Continuous Quality Improvement. So with her shift in role, Carrie Bambro, currently our office director for the Office of Services Review, is filling in as the interim division director as well. And we will include her information in the chat as well. So just wanted to let you know about those couple changes. And I will go ahead and now kick it over to some of our panelists for some of their operational updates. I will start with you, Carrie.
Thanks, Amanda. All right, we just have a couple of updates from the Division of Continuous Quality and Improvement, which mostly come from our Office of Service Review. So we are getting ready to pilot our quality tool that we met with you all about 6 months ago to go over sort of our thoughts and ideas on how we can help enhance the quality of services and be better partners with all of you. That pilot is going to start in the coming months. We're hoping to start in August, run a few through the end of December. A few of you have already reached out if you were interested in being a part of that pilot. We may be reaching out to some of you because we would like to do 5 in this first 6 months and then possibly a few more from January to next June, just to make sure we have some good information on whether or not we're asking the right questions and looking at the right things. So if you are still interested in being part of that pilot, you can give us, just let us know. I'll drop our email. You can email osrprovider@utah.gov. We really appreciate any of you who are willing to partner with us as we look to put this into our system and find a better way to evaluate the quality of the services that are being provided. Also, with our contract review team, we are in the process of updating all of our review tools now that it's the new fiscal year. Our hope is to have them all updated and available on our website by the end of July. So we'll keep you all posted, but if you will all just be patient with us for a few more weeks, we should have them ready to go and available there. And we will also post our website address in the chat so you have access to that as well. That's it, Amanda. Thank you.
Thank you, Carrie. I will go ahead, and I have been asked to fill in for Chanel with the Office of Substance Use and Mental Health because she had a previous commitment. She just wanted to highlight 2 things that have changed. One with the Utah Behavioral Health Commission, formerly USAVE, it is being moved to the Office of Substance Use and Mental Health beginning July 1, which I guess it has a week ago been moved there. Due to Senate Bill 27 of last session. And then just another celebration. We recently just attended some of the Department of Health and Human Services leadership to celebrate the opening of the Four Corners Community Behavioral Health Crisis Receiving Center. So excited to celebrate that opening crisis center that is located in Price, Utah, and excited to see those services grow in that rural community. With that, I am going to go ahead and turn that over, I believe, to you, Dean. You're on point for DSPD today, but as I just said that, we did get feedback, so I'm going to jump in and say we have been requested to not use all of our acronyms because everybody doesn't know them. So I will say Dean with the Division for Services with People with Disabilities.
Hey, thank you, Amanda. And I was going to do the same thing. So yeah, I'm Dean Whedon. I'm an assistant director with the Division of Services for People with Disabilities. I've got a couple of things for you. Number one, a lot of you probably are aware on June 18th, the U.S. Department of Justice released the results of the multi-year investigation that they had into employment and day programs for people with intellectual or developmental disabilities in Utah. And these are common. These happen all over the country, and there are ways that the DOJ sort of ensures that the ADA is being implemented appropriately into the highest standards. And we are right now working through those findings. And one of the key themes throughout the whole thing was integration, and particularly related to employment. And of course, as a state, we are highly committed to and agree that integration is the goal. For people with disabilities, should be integrated in their communities for both both employment and for any other aspect of their lives. As you probably know, we work off of an employment first model. Employment is the first and the preferable way of providing services for people throughout the day. And while the findings are, again, we're working through those, and of course nobody likes to hear that the programs have barriers for people to receive services. We are absolutely committed to improving our service system so that people with intellectual disabilities and developmental disabilities can live lives in the ways that we do. Able to be independent and being able to have connections with family, friends, and peers, and so on. So we will be working with the Department of Justice to strengthen our service system to address some of the things that they have found and that they recommend. So that's item number one. Item number two is just our contracts. So thank you to everyone that has worked to get their contracts renewed for July 1. And please just keep an eye out over in the coming weeks for signatures so that we can keep those on track. And in case you didn't know, contracts have historically been on a 5-year cycle. That has been removed. So the contracts now are in perpetuity. They will have amendments, of course, but we won't have this this fiscal year end, along with the billings and stuff that Amanda was mentioning earlier on. So these will be in perpetuity with amendments. So that we're excited about that, because that eases some of our challenges as well. Thank you, Amanda. Those were my 2 things.
Thank you, Dean. I appreciate that. I am going to go ahead and now turn this over to Joseph with the Office of Long-Term Supports and Services.
Thanks, Amanda. Happy to be here today. It's been a while since we've had something to discuss with the group. As Amanda mentioned, my name is Joseph Ambernack. I'm the Director for the Office of Long-Term Services and Supports within Medicaid. We provide oversight to the state's 9 waivers. We operate a couple of those internally. But we've been requested to speak to you about some recently passed federal legislation. This most commonly is called the Access Rule. The longer name is Ensuring Access to Medicaid Services Final Rule. And what it is a rule recently published by CMS earlier this year that has a few specific objectives, many of which affect our home and community-based services programs. Or HCBS, as I'll probably allude to it. I'll be careful with the acronyms as much as I can. But the objectives of the rule are to ensure that high quality services are available to individuals who are enrolled in our programs, that we're better able to monitor the outcomes and participant experience in the receipt of those services, is part of CMS's ongoing effort to be more consistent in monitoring across several different authorities and the way that Medicaid services are delivered, trying to increase transparency and accountability of state agencies, standardize our data and monitoring, promote beneficiary engagement to improve holistic access to care. And it's also complementary to another rule that was proposed in our managed care program. So the way that we deliver a lot of what we call our state plan services, or just the general services that all Medicaid recipients receive. Think of the inpatient, outpatient, hospital care, pharmacy benefits that are available to all Medicaid recipients. This rule is complementary to some additional legislation that affects them as well. The access rule touches on 3 general areas. One piece that we do have that is within federal regulation is what we call our Medical Care Advisory Committee. The name of that committee will shift to the Medicaid Advisory Committee. The access rule contemplates several specific requirements for that meeting, as far as the meeting frequency and cadence, the composition of who participates in that committee, and also now requires the state to develop what's called the Beneficiary Advisory Council. There are also several, I touched on this previously, home and community-based services requirements, and then some general requirements for all of our fee-for-service providers. There is the summary that we've dropped in chat for you as well, that I'd recommend you take a look at. Toward the bottom of that summary also includes a time frame for implementation. It does a really good job of breaking down the provisions of the rule, where some of them have a 12-month implementation time frame. Others could be phased in across the next 6 to 8 years. So this is going to be something that we're working on for the next little bit. Specifically, again, with the Medicaid Advisory Committee, Beneficiary Advisory Committee, it encompasses changes from just the formal renaming of the committee within federal regulation, and then also describes kind of the scope of the issues that the committee may advise the state on as far as its operation of the Medicaid program. The Beneficiary Advisory Council I mentioned is new for us. Some of the feedback that our federal partners at the Centers for Medicare and Medicaid Services was that sometimes it's very difficult for individuals from a constituent or Medicaid beneficiary standpoint to provide feedback to the Medicaid program, and previous opportunities and committees like the ones that we do have. Some members do find that to be a little bit intimidating at times, depending on who else is in that room. So we oftentimes deal in very technical terms, and sometimes it feels like individuals, or they express that sometimes they don't feel comfortable sharing those opinions. The Beneficiary Advisory Committee was intended to provide that very specific aim, where it will be a consolidated place for member and participant voices. that will then also participate in the larger Medicaid Advisory Committee. I mentioned as well that it governs the frequency of meetings, ensuring that we're making agendas and minutes publicly available, having opportunities for public comment throughout those processes, and then also compels the state to provide support staff to help facilitate the meetings and provide information. A lot of those pieces are already part of what we do, but now they're cemented within regulation for that meeting as well. On the home and community-based services waiver side, the rule does outline some general system improvement expectations. For those that are familiar, the settings rule that we've been implementing across the last 10 or 12 years did include very specific expectations on person-centered care. This rule now governs how the state is expected to monitor and oversee provider implementation of those items. So a little bit more refinement on our quality assurance side. There's also expectations for how the state engages in its critical incident management process, including the types of incidents that we're required to investigate, how the data is collected and managed, how that data is then analyzed for any trends that we're seeing within the system, either between the waiver programs themselves, perhaps with a given provider, or a member perhaps. So just again, a little bit more specifics on state expectations. The rule also outlines a grievance system for items that may not rise to a fair hearing or appeal situation that could be a complaint or grievance from a member or provider perspective. And then I think this group, or certainly the providers on this call, are aware of reimbursement for our services being a significant topic of conversation across the last several years, this year being included as well. The rule also requires the state to collect information on cost reporting from providers specific to homemaking, personal care, habilitation services, and services that are rendered by home health aides. The first part of this portion is for the state to develop the cost reporting information. And then in a few years' time, there is an expectation as well that the state is able to reflect that 80% of the rate paid to providers is then being shown in the form of direct care compensation. So be it in the salary, the wages of individuals, perhaps with the benefits that they receive. That will be, I mentioned, kind of the 6 to 8 year implementation timeframe. Again, the first phase is collecting the data, and then the second is going to be that demonstration of 80% being paid to the direct care staff. Inside of CMS's expectations as well are a little bit more transparency behind information on the wait list specifically, and then kind of the timeframes that individuals can reasonably expect before they are able to access services. And then once enrolled on the waiver, the time between that waiver enrollment and when services begin to be received by the individual or family. There is also provisions surrounding quality and performance on our compliance measures. Some of them are public facing today, but usually aren't in a format that is easily understood or readily accessible to individuals. The rule compels us to provide this in a more accessible format, as well as kind of, again, making them more transparent and public facing. And then just lastly, I mentioned some fee-for-service items that apply to the Medicaid program in general. One of those that will affect all of our programs, including our waiver programs, is the publication of fee schedules. So those are, again, are transparent and available to individuals who are curious about the rates we pay for given services. As well as the development of what CMS has called an interested parties work group. And we're still trying to see how that blends in with the Medicaid Advisory Committee I mentioned previously and the Beneficiary Advisory Committee, but in an acknowledgement too that when we're talking about the pressures that the direct care workforce is currently facing, we don't necessarily have a great channel for them to provide that input to the Medicaid program at this time. So trying to find a mechanism to also include that as part of our feedback loop as well. And just kind of sharing where we are as a state, but we're currently working with partners at the Division of Services for People with Disabilities, the Division of Aging and Adult Services, as each of us kind of have a different hand in the operation of these programs. Some of us are a little bit further than others in various aspects, I think a good example is the Division of Services for People with Disabilities having a pretty good pathway for participant experience surveys, where they've been conducting those across 10, 15 years now. A few of our other programs have not been receiving that feedback on a regular basis, or currently are doing that. So again, the rules cement some of those expectations, and we're trying to match up the areas that are doing well, and then trying to bring the others up to where the rule requires. And then a few pieces, I know I may have scared a few providers, but the cost reporting requirement, we are still urgently waiting for some sub-regulatory guidance on what exactly that cost reporting needs to look like. And we'll be sure to share that as soon as we have something that's substantive to bring back to you. Just know that we're continuing to work on that with our federal partners as well. So certainly, if there are any questions on what you view with the final rule, or if you have items for me, I can go ahead and drop my email in chat as well. But please reach out to us if you have any questions, if there's concerns that you have after having an opportunity to look at the summary. But I encourage you to take a look at the one that we provided from CMS. They've done an excellent job of breaking down the big items in a pretty digestible format. So please share any questions or concerns that you might have. Thanks, Amanda.
Thank you, Joseph. I appreciate that update. Big rule update. So I will go ahead and turn it over, I believe, to you first, Shannon, and then for a Division of Licensing and Background Check.
Thanks, Amanda. I think that honestly, I've probably been in meetings in the last 2 months with the majority of you, but for those that I haven't, just in case, as Amanda said, Shannon Terman Black, many of you have worked with me in my previous capacity as Director of Division of Continuous Quality and Improvement, and I'm excited we're going to continue to get to work together just in my new capacity as Director of Division of Licensing and Background Checks. Like I said, really excited to continue to be able to help Utahns have the opportunity to live safe and healthy lives from a new perspective. Well, that being said, I am going to first turn over to Simone. He has a couple of updates for the Office of Licensing. And then Simone, I think we'll pass it over to Daphne for a couple of updates for the Office of Background Processing. And again, as Amanda said, please feel free to reach out to me. My email has not changed, nor is my phone number. Happy again to be here and to start working together with all of you.
Thank you, Shannon. Simone Bolivar, Director of the Office of Licensing. A couple of announcements and a piece of information. So just a reminder that on July 1st this year, the new fees took effect for human services programs. So if you have questions about the cost of the new fees, we had a 10% increase on the fees, and our fee schedule is posted on our website, dlbc.utah.gov. DLBC as Division of Licensing and Background Checks, dlbc.utah.gov, and the fee schedule is posted on that website. Also, these are fees both for licensing and also for background checks, but Daphne might increase information on that. The other piece of information is that some of you might have received some information about the new contract that requires day support providers to get either a certification or a license from the Office of Licensing. Please be aware that some of these programs, some of these day support providers were not required in the past to have a certification or a license, but this is a change. So if you need any information on how to process a license or a certificate, the same information is also posted on our website, dlbc.utah.gov, or you can ask us information directly to either one of us, Amanda Lenti, or myself, or any of the licensors will be able to give you that information. Again, for day support services, we will be requiring either a certification or a license, depending on the case and the number of clients you are serving. And in addition to that, based on the need that we have to certify DSPD providers faster to be able to make the placements in the fashion that we need to. We will be piloting a self-certification process, and we will give you more information about this process as the pilot process is evaluated, in which we are hoping to expedite the process and give DSPD providers the opportunity to be ready for placement faster. This will also address some of our background check processes, will expedite and facilitate training and services for background checks. So again, this is just the beginning of the information you will be receiving. We'll give you more information as this pilot process is implemented and we see the outcomes of it. Thank you, Daphne.
Great. Thank you, Simone. You gave me great things to piggyback off of. And so as Simone was stating, we're getting ready to roll out some new processes. And this also kind of ties into what Carrie was speaking about, is we are working towards having a new portal for background checks to eliminate all paper background checks, and that applicants can just enter in their information to complete a background check through the system, and hopefully to expedite this process. And so more information will be coming out about that portal. Also, as Simone stated, as of July 1st, background check fees have increased. And so the total cost of a background check is now $53.25 to be enrolled in the FBI Wrap Bag. And then finally, we are continuing to work and address the timeliness of the background checks right now, and we are doing everything that we can to ensure that the work we do is completed timely and efficiently. And so, but if you have any concerns, you can always reach out to myself at dlynch@utah.gov or to the CBS unit at utah.gov as well. That is all of my announcements.
Thank you, Shannon, Simone, and Daphne. I will go ahead and turn it over to our public affairs and education individual to give just some DHHS updates.
Okay, hi everybody, I'm Danielle. I am the Public Information Officer who is covering the Public Affairs and Education portion of the meeting today. So what we really want to update you all on is that last year we received $500,000 in funding from the Utah Legislature, and we ran a campaign to help parents better understand the harms of social media on their teens. I'm sure you saw many of our efforts. We had billboards, we used social media, and then we also had specific video ads as well. We're very proud of the campaign. It had powerful results, but it is complete now. And so we are excited to share these results. These results are primarily coming from a survey that we sent out to the public after completing the campaign to figure out if our campaign made a difference. And what we found is that before the campaign, 43% of parents who were surveyed said that kids shouldn't access social media until they were at least 16 years old. After that campaign, that number went up to 46, so we're excited to see an increase there. We also found that 63% of respondents recalled seeing or hearing information and advertising about the effects of social media on youth. And then before the campaign, 20% of parents said that they set a limit of no social media for their children. And after the campaign, that number went up to 25. So we're excited about that increase as well. We also saw results about slight increases in using parental controls, parental monitoring, and then limiting social media use at certain times of the day. And then overall, our results showed that 28% of respondents said that they took action as a result of the campaign. And we're really excited about that response rate. And Amanda, that is everything I have. Thank you.
Thank you, Danielle. Appreciate that. Well, thank you for all of you that have provided updates today. We are going to go ahead and move to our questions and answer portion of the meeting, as always. In addition to those individuals that gave updates, we also have individuals from our Office of Coordinated Care and Regional Support, our Office of Legislative Affairs, and our division with Child and Family Services. So if you have any questions for them, feel free to drop them in the chat as well. As I mentioned at the beginning of this call, you can submit any questions prior to this meeting or outside of this meeting through our email address, DHHS_CQI@utah.gov. We will drop that in the chat. That way, you know, some of the more complex questions, we can get the answers ahead of time so that we can provide those to you. Or if you have specific questions that are a little one-off, you can always email them as well and we'll address them. I will go ahead and start asking the questions. So I think that I am going to start with you, Dean, if that is okay. It said, the question is, what kind of simplification of requirements are being considered to make it more likely that we can help a person with disabilities find employment?
Yeah, thank you. I'm going to see if Marcy is on the call. She oversees our services. Marcy, are you available there?
Yeah, I am on the call. I'm not sure I quite understand what they're getting at with the first one. I'm not sure what they mean by simplification of requirements to being considered to make it more likely. I'm not quite understanding that one. So maybe they could give us a little more context.
Okay, thank you. Yeah, if the individual wants to add some more context to that question, it did pop in when Dean was giving the overview of the DOJ. So I'm assuming it's something as far as, I shouldn't assume, but I am assuming it's about helping individuals find employment. And I think we can go back to, as Dean said, we're still reviewing it. We absolutely want people integrated into the community and, you know, we'll be doing our best to ensure that. So with that, I will go to the next one. And I don't know if this is Dean or Marcy, so you can tag in. Why did the rate for caregiver compensation with the new code reduce drastically from what it was?
So part of in designing the new program, we were trying to, everything that we've ran on with caregiver comp up until now has been a temporary program that was part of the public health emergency. And so in designing the new program, the goal was to systemize and make it where no matter which model you chose, whether it was the self-administered or the provider, that the rates were congruent so that the hours lined up the same on both programs. And that did have some effect on rates, but that it was just to align everything. I don't think it was a drastic decrease, but it was those providers that are providing those services can pay they pay different amounts depending on what their overhead is. So we just aligned the two programs, whether it was self-administered or provider, to be the same. And that may have been a side effect for some of those.
Perfect. Thank you, Marcy. Keeping with our division of services with people with disabilities, are there alternatives to obtaining clients other than those through ISOs for DSPD clients? And I will ask, as a person who forgets what ISO stands for, if you'll please say what that is.
So the ISO process is our invitation to submit offer. And so when we have somebody looking for a new provider, we have them, the support coordinator will put out an ISO so that it goes out to all the providers and it gives some basic information about what the person is looking for so that we can have the providers interested or that have availability interview with the person, and then they get to choose which provider that they go with. That is the main way that we do try to create choice and make sure that people have all the options available to them. So it is our main way of doing things with helping someone find a new provider.
Thank you, Marcy. I will give you all a break, and I believe that this question is for Daphne. Do background checks typically take 3 to 4 weeks to process? My host home providers are hoping for something more immediate.
Thank you. And yes, that is the current time frame to complete a background check once the fingerprints are taken. We typically receive an influx of background checks this time of year, of which we acknowledge and we are doing our best to address. But this also has a domino effect on when we receive the record back. And so sometimes some of the delays are because we haven't received the fingerprint results back yet from public safety in order for us to complete the background check process. And so right now we are looking at 3 to 4 weeks and are looking to improve that time frame as well.
Thank you, Daphne. I will go back to another question and I will try to answer it. And any of you can jump in and help me fill in. It says, can you describe who should be here? We weren't 100% sure if we had to be here, but we received an email invite. Yeah, so this email does go out to all DHHS contracted providers and invites them to this call. Typically, we have representatives from our juvenile justice, child welfare, disability services, licensing, background processing, legislative affair representatives. So if you have any questions, those are typically the type of updates we have, as well as general department updates. So if you want those updates from those individuals, you would be the individual that would want to be at this meeting. It does vary on the topic in which we're covering. So we try to send the agenda out ahead of time with the topics we're covering so you can review that and see if it's relevant for you to be there or not. So I will answer that one. And I'm going to go ahead and shift to Daphne again. We'll start with what happened to the 10-day expedited conditional approvals. We were told that that doesn't exist anymore, but is still in statute. I am making the assumption they're talking about background check conditional approvals. So if that's incorrect, please add that in the chat.
Right, no. So we still, if we have received fingerprints or the applicant has been fingerprinted and it's been more than 10 days since they have been fingerprinted, that is when you can reach out to the CBS unit at utah.gov and we can get those expedited for you. My one caveat with that, and we want to honor those as well, but if everyone requests all of their employees to be expedited, that kind of continues to put us into the same pickle that we're kind of in and we're trying to work out of right now. And so I do just request that you are mindful and only do the ones that are really impacting your business needs or that really are impacting your services to clients, that we can really focus on what really does need to be expedited and then continue to work on the oldest applications that we've received first.
Thank you, Daphne. It looks like there's a few different more questions, so I'm going to stick with you if you don't mind. Will there be more locations where we'll be able to send individuals to fingerprints or to get fingerprinted?
Okay, that is a great question. Currently, we do try to have an updated list of everywhere we are aware of in Utah that provides fingerprint services. And so that includes up north or down south. And for us, there is quite a large variety. If there are specific areas where you're having trouble getting fingerprint appointments for whatever reason, I have not heard of those, and so would like you to bring those concerns up to me, and so that we can look and find if there are areas that that we can improve or even share some additional contacts for where to be fingerprinted.
Perfect. Thank you, Daphne. And we'll give you just a break for a minute and I'll switch it over to Dean and Marcy. Back to caregiver compensation. It says the The FAQ says that caregivers should have the same training as the provider staff. It seems over the top to have them trained to the same level as our staff. A background check for a parent to care for their child seems like a lot. A food handler's permit for a parent to cook for their child seems like a lot. Can we have some wiggle room with caregiver training and certifications? And I don't know, Marcy or Dean, which one of you want to take that one?
Yeah, these are requirements that the providers have for any staff. And so by employing a caregiver, they are still held to the same. We haven't really discussed alternatives for that, or if there can be alternatives for that. So that's something I can take back and we can discuss further in the division.
Thank you, Marcy. I appreciate that. Right. I would love to move back to Daphne, it looks like. If we run a federal background check individually in less than a week, why is it taking 4+ weeks to run it through the Office of Licensing? It's difficult to retain staff when we are waiting on licensing background checks.
Thank you. So I cannot speak to what is run during a federal background check. What I can speak to is our background checks. Our background checks are fingerprint-based background checks on those individuals. And not only do we receive results from RATBAC from the FBI, which RATBAC stands for Record of Arrests and Prosecutions. And so nationwide, we are notified of any arrests or prosecutions. And then they're also enrolled in RATBAC, which means if they are arrested or prosecuted in the future, we will receive that alert. But we also do name-based checks on a variety of databases, which is outlined in statute as well, such as Child Protective Services, Adult Protective Services, the Utah Sex Offender Registry, as well as Utah courts to ensure that there are no records of abuse or neglect or any recent criminal or non-criminal offenses, which would cause concern for them to be working with the vulnerable population. And so that's the why it takes sometimes a while. And then also our process currently stands that if there is something that, I mean, of course, we cannot disseminate what is on an individual's record, but if there is something that causes us alarm or that is concerning, we follow a process so that they can respond back to us and provide us with additional information for us to review all the facts and the circumstances before we make a final determination in allowing them direct access or not.
Thank you, Daphne. I think we're getting close to the time there, but we've got a few more questions for you, if you don't mind. It always seems that we start talking about background checks and all the questions turn to background checks. So apologize, Daphne, we're gonna put you on the spot. I guess you can back in with Shannon if you need. Question is, the background checks are for whom?
So the background check should be for anyone with direct access. So if you are contracted with a department, if you have a license or a certificate, it is going to be for you and your employees or anyone associated with that license or contract or certification.
Thank you. We'll move to the next question. Why is there a delay when there are glitches with existing people in DACs and requiring FP check days or weeks later after initially appears to be cleared? Assuming the FP stands for fingerprint.
Right. So this one, I'm not sure I'm fully understanding the question, but if you are referring to if an an applicant or an individual already exists in DAX, and it might be that they appeared to have a determination, and then later comes up that we make another determination there. So that can be a couple number of things. That could be that they had a previous determination for another program that cannot apply over. We do our best to try to make sure that we are not duplicating in any efforts. And if we've made a determination for whether they've transferred from another program to your program, that we can just transfer that over without having to run a whole new background check. There are some instances where that cannot and may not apply. The other thing is what I've talked about with wrap-back, is if we are notified of any new records of arrest or prosecutions, again, things that would cause concern, that will also update in the status and will require us to be moving forward with following those processes, and where we might make a new determination, even if we've previously made another determination. But since I don't fully understand the question and I'm not sure I'm answering it correctly, feel free to reach out to me and we can talk about that more if I'm not answering the question for you.
Thanks, Stephanie. I'm gonna go ahead and kick a question back to Marcy again. It says, my question wasn't quite answered. I was wondering if we had other ways to obtain clients other than through ISOs.
I mean, that is our main way of getting information out and getting people the right to make choices. So that is our method of choice. Maybe Dean has another answer, but I don't. That's the way we try to do it so that it's fair and people have a lot of choice in the situation when they're looking.
Yeah, I'll echo that, Marcy. It's how we ensure that the person's able to choose. We are taking a look at that process, though, just to make sure that that goal of promoting proper choice is fulfilled by the way that we do the ISO. Occasionally, someone will directly choose a service or a service provider. That's the only alternative that I can speak to. Is we wouldn't go through the ISO process if a person said, "I know who I want, and this is why I want," that's a direct request. So again, but it's all grounded in choice.
Perfect. Thank you all. And then the only thing I would add on that, assuming that ISOs, because that is a DSPD process, we're making the assumption they're talking about DSPD clients. However, providers that may want to serve clients in our child welfare system or our juvenile justice system, we do have contracts available that you can go and respond to those RFPs through our department contracts. And if you're interested in providing services for those individuals, that would be the way for that. I don't know if any of you want to add to that, but I just want to put that out there that not all the clients that DHHS needs services for go through the ISO process. That is the DSPD process to ensure the individuals have choice. But there is contracts out there to serve other children or individuals within DHHS services. All right, we've got a few more minutes here, so I am gonna go ahead and kick it back to you, Daphne. There's a lot of questions here.
Love it. I love getting all these questions today.
Yes, so we have a lot of our previously eligible employees being moved to supervision required when that is not something, when there has not been something in their criminal history. Is that something that you are aware of, and is there anything we can do to help avoid it? It can take a month or more to get that resolved.
So to answer this question, the only reason that a previous eligible employee may be moved to supervision required when there has, and again, I can't speak to whether or not there is any change in criminal history, but the other reasons why are if we do not have a disclosure form for them, whether it's an electronic one or a physical copy that has been uploaded to DAX, which provides us with the authority to be completing the background checks and then to be reviewing it on an annual basis for any wrap-backs or renewals, which we are required to have to be compliant with the FBI in completing these background checks. Or if we don't have that information, I am like, if their profile has not been updated and we don't have all of their personal identifying information, such as their social security number, the current address, if any alias names or name changes, those are the information. Or the final one, which for this call may not be completely applicable, but if they have work or if they have lived out of state in the last 5 years, there are certain times that we allow them to be working even without being directly supervised while they are working to obtain the out of state that what they resided in the out of state child and abuse registry check, and we have not received that within a year, we cannot then proceed with this next year of having that as well. So those are the other times, and it's just a matter of we need to get one of these resolved so that then we can get those updated. But again, those are the 3 that I can think of. And they again should be quicker than a month. So I would like to learn more, or if that is something that has not been addressed there, that we can work on better practices moving forward.
Thanks, Daphne. Looks like we've got a few more minutes, so I'm trying to look through here to get some questions. And go for you again. I'm gonna take some liberties with this question. It says, when will the new BCI portal roll out? I may have missed when it was announced. We're not BCI, so we won't have a BCI portal, but I'm assuming when will the new background check through the DAX portal?
Right, and thank you. And so we are again looking to have that be rolled out within time frame. It would be the next couple of weeks or the next month. In full transparency, we are just working on a couple of like the billing portion on making sure that is going and working with the developers on making sure that is all in line. And so then we can quickly do our final steps of testing and have it be rolled out to everyone.
Okay, thank you, Daphne. Go with maybe a simpler question. Do employees need to do wrap-backs annually? If so, how do they go about doing it electronically?
No. When an employee is fingerprinted, that is when they get enrolled into wrap-back. And so we will keep that and have that for as long as they remain associated with your program. It currently states that then if they leave and do not return to another program within 6 months, then at that time, we will cancel that. And they will have to start over if it's been 6 months or essentially 180 days or more.
Daphne, and then a question here that maybe for you, but maybe for DSPD. It says, is DAX the only background checks that needs to be completed for caregivers?
Okay, so as far as I am aware of, and I would appreciate any additional support, our office completes the background checks for those that are contracted, certified, or licensed with the Department of Health and Human Services. And so those are the ones that are acceptable, or it's just you go through our office to complete that background check to meet these requirements.
And I would agree, that's what's required in our system is your process.
Perfect, thank you. And then Daphne, when the DAC system is changed, will training be provided to providers?
Yes, we will have training for providers, and as I'm going to say, we're putting this more on the applicant so that you are understanding, as you're probably going to be that first line of questioning, that they're going to come to you rather than coming to us. And so we will make sure that the training is out so that you can even see how the process is to work and step through all of that as well.
Thank you. And we're right at time, so I'm going to give one last question here. I know there's some additional questions that haven't been responded to, and so it looks like a lot of them are regarding background checks. So we did drop those email addresses in the chat. Feel free to reach out directly to the Office of Background Processing or Daphne. This last question, I'm going to go ahead and shift gears, and it may be Joseph and then maybe DSPD that would answer this. Are we able to provide services to those who have Medicaid but not DSPD, even if we are contracted with DSPD, since it's an umbrella model almost?
Yeah, I'm happy to touch on this, and if Dean or Marcy have additional comments, I'm more than happy to turn some time to them too. But the short answer is that it depends. It depends on which program you are providing services for. If it is more of a general Medicaid program like autism services that are not involved with the waiver program, your Medicaid enrollment would be sufficient, as you're then not billing DSPD, you would be billing Medicaid directly. I would be careful as well that if there are services that are provided through one of our managed care plans, through the Medicaid state plan, that you're aware of the requirements there and are contracted with those entities. If you are seeking to provide waiver supports, however, residential habilitation, day supports, it is required that you have a DSPD contract in order to be added to the care plan, to be part of that individual service plan. So it is not kind of a one or the other. If your intention is to provide waiver service, you do have to be contracted with DSPD in order to do so.
Thank you, Joseph. Appreciate that. Well, we are at time, so I want to thank everyone who has joined us today. Thank you for your questions and your feedback. We do appreciate all of your partnership and your serving individuals to ensure that all Utahns have the opportunity to live fair and healthy lives, or healthy and safe lives. And just again, we want to make sure that this time is always useful for our providers. So whenever we send this email out, there's always a survey at the bottom. Feel free to provide feedback to all of us. Again, we know this meeting is every quarter. Feel free to reach out in between that to any of the individuals on this call or within DHHS. We look forward to seeing you all on October 8th at 12 p.m. Have a wonderful day.